Good afternoon, everyone. My name is Justin Petroniani, and I'm a National Account Executive at Softheon. Thank you for joining today's webinar with Softheon and the global management consulting firm Oliver Wyman on navigating the new normal, employment, unemployment, and the new commercial mix. Before we begin and introduce our speakers, we'd like to quickly relay some housekeeping items. Everyone has been muted. If you have any questions, please feel free to use the chat function. We will hold a Q&A after our speakers have finished with their presentations. And finally, this webinar will be recorded, and we will distribute a copy of all the recordings to all the participants. With that, I'd like to introduce our speakers. First, you'll be hearing from Howard Lapsley, a partner in Oliver Wyman's Health and Life Sciences practice. Howard recently published a series for Oliver Wyman on unemployment's tipping point and a new commercial mix. Today, Howard will be discussing the impact of COVID-19 induced employment and the future commercial mix scenarios. Second, we will hear from Softheon's General Manager and SVP of Health Plan Cloud, Kevin Deutsch. Kevin will discuss the new normal for employers, employees, brokers, and consumers, and how health plans can navigate the new normal. With that, let's get started. And I present Howard Lapsley on the unemployment tipping point.
Thank you. It's a pleasure to be with everyone today. Just by way of introduction, our healthcare practice has been building a number of models to help payers and providers navigate the path through the new normal. We're going to focus today on varying unemployment impacts and what that does to the payer commercial mix shift and what the implications are for insurers as they go forward. Just one other note here on this slide: our pandemic navigator model is available. Some portions of it is available on our website for the public to use, and they've been finding it very helpful, payers and providers alike, and other interested parties, in thinking through both nationally at the state and at the county level what the varying curves would look like going forward. And the results of that, the model as it's been playing out, have been really, really accurate. So I encourage folks to go to our website and look at that model as well. In addition, going forward, we're going to be marrying that navigator model with our commercial mix shift model to predict back to work scenarios and what that means in terms of reemployment as we come out of the COVID crisis. So look for more information on that. But as we think about where we are today, we really are in unprecedented times, and the path forward, thankfully we're starting to see a little bit of the bending of curves, and thankfully we're starting to see a decrease in the rate of unemployment, but there's still plenty of uncharted waters ahead. At first, not thinking about how the extent of where this is going to go, there is a lot of the investment banks are quite bullish about our ability to come out of this at the end of this year and into the first and second quarters of next year. We're seeing that somewhat tempered now as the pandemic still seems to be nagging, and different states are having different results as they reopen. But just to put in perspective where we are today in terms of unemployment, the new job loss figures came out this morning of additional 2.4 million people being out of work. And that is actually a decrease in the curve. They were expecting almost as many as, potentially some reports, almost as many as 4 million claiming unemployment today. So that's a positive sign in terms of that's only 2.4 million. But since the beginning of March, where we had 3.5% unemployment, the lowest unemployment in over 50 years, we've lost close to 39 million jobs since the beginning of March. And to put that in perspective, our real unemployment numbers now are hovering around 25%. That is right where we were at the worst part of the Great Depression in 1932-33. And when you think about back to those Great Depression days and think about the footage you've seen or what you've read, Grapes of Wrath or soup kitchens and bread lines, and then you watch the evening news and see all the cars lined up for miles to get food. We are in that kind of dire economic condition today. And again, the notion of it's encouraging sign to see that some of that unemployment is starting to level off. and we'll see how quickly those jobs come back. Lots of debate about the extent in that. If you look back at the Great Recession in 2008, 2000 through 2010, where the highest real unemployment was around 15%, so we're well in excess of that now, and that was focused on, you know, a much smaller sector of industries. There aren't that many lessons we can learn from that in terms of commercial mix shift and in terms of back to work. Most recessions have a 2 to 3 year recovery period until jobs get back to normal. But again, we could see, you know, fairly severe unemployment continuing over the next 12, 18, 24 months. In terms of commercial mix shift, we did see largely a return to the status quo for those jobs that were lost back to employer coverage. But there are a couple of notable differences between now and then. Obviously, the severity of the impact and the industry focus, and especially the focus on small group, but also the fact that we have ACA exchanges available now where there weren't ACA exchanges available then. There was a pretty substantial COBRA subsidy that was put into place in 2009, a 65% COBRA subsidy, which really helped. We don't have a COBRA subsidy yet, and unlikely that we will, because I don't think the government wants to, well, there's still debate about whether there'll be interference with the ACA exchanges, but the availability of the ACA exchanges, again, as I said, is different now. So it'll be really interesting to see how this plays out, but we are in a very, very severe unemployment scenario right now. And as we've been tracking the unemployment scenarios, it is following our modeling pretty closely in terms of what we predicted, which is first starting with a number of targeted industries, which you can see here on the slide that I'm showing now, where those industries that have the largest negative shock to them are on the left-hand side, and the size of the bubble represents their percentage contribution to the GDP. And so those are the industries that were impacted first, going from left to right. And that is what we've weighted in our modeling at the national and at the state level. Things like thinking about part-time versus full-time employees, spousal coverage, et cetera. And as the employment has become deeper, it is spread more widely across industries and has actually moved up market in terms of salary. So we saw a pretty steep curve in the lower wage earners at the beginning. That is starting to level off, and we're seeing an increase in the higher wage earners now, those jobs over $100,000. And that's how we programmed it in our modeling, and that's how it's playing out. So it seems the real empirical evidence that we're seeing in terms of unemployment trends are playing out in our model. You know, one interesting thing as we look at this and look at the shocks of this and the fact that we're on unprecedented times, who would think that Zoom's market cap would be 10 times that of United Airlines, which it was as recently as last week, or 4 times that of Delta Airlines. So that's where we are now in terms of modeling output. Here's the headline, as you can see on this slide. And so what we've done, and let me explain this slide a little bit, and there's a lot of numbers here for you all to digest, and we'll get into this in more detail in subsequent slides and break it apart. But if you look at the 4 groupings of bars on the left-hand side, those are those covered lives, so employees plus dependents, those covered lives that have employer-sponsored insurance. And the gray bar is where we are today in terms of covered lives. And as we get to different unemployment scenarios, 15%, 20%, 30%, you can see the outflow of lives from the employer ranks into the 4 groupings of buckets on the right-hand side. So those lives will leave the employer coverage ranks and migrate into individual, Medicaid, Medicare, and uninsured. And this is a snapshot for the end of this year, so roughly December of 2020, where we're seeing peak unemployment. We're seeing a lot of the CARES Act benefits in terms of extra unemployment benefits. Those have run their course. Furlough programs that were in place have run their course. This takes into account those that have spousal coverage and can go on to the spouse's coverage if they get laid off, the percentage of that. This accounts, as I mentioned before, part-time versus full-time workers. It's weighted towards specific industries when we get down to the state, at the national and state level. Takes into account those states that are Medicaid expansion versus not Medicaid expansion, et cetera. And so what you see here is, significant migration out of employer-sponsored coverage into those four buckets. And if you look at small group, for example, on the left-hand side of the slide here, under a 30% real unemployment number, which we're fast approaching, you could see roughly a third of the lives in the employer small group market disappear by the end of the year, either through unemployment or employers dropping coverage altogether. So let's take a look at this in a little bit more granular detail. So here's the 20% unemployment scenario, which we in essence are at right now, if not a little bit ahead of that. You would see 25 million lives migrate from commercial into either uninsured individual Medicare or Medicaid. Now, interesting note on the Medicare. So for Medicare, 8% of the working population is over 65. And so when they work for an employer, their employer-sponsored coverage is primary and Medicare is secondary. And so when you're thinking about revenue and reimbursements for providers, when they go on to Medicare, if they've been laid off, and that portion that you see of that 8% that's been laid off, they then migrate into Medicare coverage. You see a significant bump into Medicaid, a big bump in uninsured, and a big bump on the individual market. So some of that will change in 2021 as those that have migrated into the individual market on an unsubsidized basis either decide to go uninsured because they can't afford it, or they now newly qualified for Medicaid in 2021. At the 30% unemployment scenario that you can see here on this slide, same general story, but we're talking about 41 million lives migrating out of employer-sponsored insurance into one of the other four buckets. And you can argue about which of the four buckets, whether someone's going to decide to go uninsured or decide to take up coverage, or decide to, and whether at varying income levels they start to qualify for Medicaid and how quickly that is. But you're going to see a significant exodus of covered lives from employer-sponsored coverage by the end of the year, no doubt about it. Just to highlight some of the differences that we see on a state-by-state basis, for example, and here is just an example of Wyoming on the left and Indiana on the right. So Wyoming is weighted towards small group, industry is weighted towards more accommodation and food services and healthcare, and they take Indiana, which is more manufacturing and retail oriented. And you can see there is definitely a difference by state in terms of the proportion of newly unemployed group members that are covered by that are in the late unemployment scenario. In this case, it's 20%. So you can see how differences in terms of industry mix and small group versus larger group pan out in terms of the proportion of newly unemployed group members. Here's another example of differences that could be in states. Here's those states that have Medicaid expansion and open exchanges versus those that do not. So Texas is a non-open exchange and non-Medicaid expansion state. So they have their proportion that the newly of those that flow in terms of the total is less for Medicaid than it would be in California, for example. And it's the same with the individual ACA exchanges. So what does that mean in terms of revenue impact overall? So this is overall industry average monthly revenue. And the revenue impact actually can be a little bit counterintuitive, because as you can see, at a 30% unemployment number, industry revenue actually goes up. Now, why is that? It's because what you're doing is you're getting the outflux of a lot of low margin and low revenue customers from large group self-insured, for example, migrating into higher revenue per customer areas like the ACA exchanges and into Medicare and even into Medicaid. That's very different from a margin impact, which you can see at the bottom of the page, where you have, significant margin impact. Again, this is at a monthly level, going at 15 to 20 to 30% unemployment. So what does this really mean in terms of considerations for the new normal as payers plan for that? And what do they have to start to think about and act upon, and where are we already seeing evidence of that in the marketplace? So first and foremost, understanding the long-term impact of what this commercial mix shift means, including at the local average, and really making sure you're reallocating your areas of focus in terms of both product development, sales and distribution, and operations and service around those new buckets where you're going to start to see significant impact. And if you're a payer that has a large, broad portfolio of lines of business, then you just have to make sure you're allocating your resources and staying on top of innovation accordingly. If you're a payer that is not present in one of those new growth areas, then that's another real warning sign. Things that you need to think about and capabilities you may need to acquire or understand further. The impact, as you saw in the modeling, is particularly acute in the small group, and you'll see small group players getting out of it altogether. Thinking about if there's ways that they can really skinny down any kind of benefits they offer. In particular, that's across the board. As I said, there'll be a bump in Medicare, and particularly we would think because of the affordability crunch, Medicare Advantage zero premium plans would particularly benefit from that. Short-term insurance, there are some states where the short-term insurance plans are actually not as skinny as in other states, and also, say like Idaho, for example. And then in certain states, you can renew that up to 36 months. So that might work for some, but remember, in general, those are really skinny benefits. And of course, they're individually underwritten, and you could be denied for pre-existing conditions, unlike ACA products. It was interesting going into this past open enrollment period. There have been trending towards, for employer-sponsored coverage, more back from consumer high deductible plans have been significantly increasing and being offered, and being offered as the only option, and also having increased utilization of those plans. But we started to see the pendulum swing a little bit back because as more self-insured employers, especially, were pushing and innovating more holistic well-being kinds of programs, those were mapped better to more PPO-like plans. But with the onset of the pandemic and the affordability crunch and the dire economic situation, look for a rapid resurgence of consumer high deductible plans and further cost shifting onto the employees. So a lot of pressure, not only for the mix shift, because providers who are now seeing more profitable commercial insurance patients come through their doors that are now less profitable Medicare and Medicaid patients, are going to put even more pressure on their contracts with employers and payers, et cetera, for those employee-sponsored health plans. So there's extra pressure on them, extra pressure from their own economics, and obviously consumers are going to bear the brunt of some of that cost shifting. And it's going to be very, very tough on them. And so you could see, I'll talk more a little bit about the cost shifting in a minute. You could see a bigger uptake in the ICHRA plans. We estimated there might be as much as 5 million lives, primarily weighted towards the lower end of the market, but across the board, that could be in some kind of ICHRA, take up. That we could see double that potentially over the next 12 to 18 months, 24 months. You could see a growth in self-funded plans or level-funded plans at the lower end of the market as a way to combat premium volatility, and there most certainly will be premium volatility over the next couple of years. Actuaries are struggling right now to put pricing in place because you've got a lot of unknowns and uncertainty about when elective surgeries will start to take place. Overall population health will be in decline because you've got a lot of avoidance of services, a lot of social determinants of health issues that are playing in there. So there's a lot of uncertainty in terms of how to think about and price based on trying to predict what the utilization and cost of services are going to be going forward. So there could be some more level funded plans to be able to, or self-insured plans to be able to, and with reinsurance obviously, to be able to have more stability there. You will see, we already have seen over the last few years a significant growth in critical illness and accident plans in terms of medical supplement policies, primarily as a way to offset costs of the cost shifting that's been put on consumers. So you look to see a continuation of that, plus potentially a growth in new kinds of gap products, ones that are more tightly linked to the medical benefit. So we already saw that pre-COVID, and we're going to see that continue to accelerate post-COVID. As you all have probably seen and read about, virtual care is here to stay. I mean, the genie's really out of the bottle on that one. Our research has shown that once consumers or employees have tried telehealth or virtual care, they like it. It's like the old Kicks commercials. Or for those of us of a certain vintage here, Mikey likes it. And so no question going forward, digital care, virtual care, telehealth, et cetera, is going to be an important part of access to care and benefit design structure. And payers are going to have to work with providers to get the reimbursement right on that, because not only is it efficient, but that's what consumers want, because they've tried it, they like it, and if they don't have to go into a hospital where they can catch COVID or catch some other virus, then they're going to prefer that. And as we've seen also, behavioral health already was growing in importance, and even more so coming out of the pandemic. Provider sustainability is a huge issue across the board, but also for payers. And we've seen all kinds of ways that payers are helping providers stay afloat, whether it's advancing payments or and those kinds of things going forward. In terms of thinking about innovation particularly at the smaller end of the market, the broker is the key communicator, as has been. In research that we did pre-COVID, and is certainly bearing out during the pandemic, particularly in the smaller end of the market, the sizable majority of HR benefits CFOs are outsourcing the decision-making around benefits to their trusted broker. That will continue and remain so. Even though there has been slight uptick to direct-to-carrier contracting, the broker will continue, particularly at the lower end of the market, to be a really important channel and ally for both the payers and also the employers. So that's the rapid run through of our modeling and some of the implications that come from that modeling. Now that we've done stuff through that, I'm going to hand it over to Kevin to step through what he and his team at Softheon have been observing while working with payers across the country, and solutions to consider as we enter the recovery phase from COVID-19. So I'm going to hand over the controls here to Kevin.
Thank you so much, Howard, and bear with me for one moment while I get my screen up so you all can see it. Some really great insights from the team at Oliver Wyman, and we really are thankful for our partnership. And I think this is a really great transition point into some solutions to consider as we move into the recovery and renewal phase associated with COVID-19. And there's really a revolvement around 5 main themes as we go forward here. And some of this is what Howard had already alluded to. So I will keep this part brief. And the first is around reshaping primary care. And when you think about this, it's an uptick in the telehealth and retail clinics and moving in that direction where you're starting to see changes in where the actual care is provided. And that leads to the second point, which is site of care. So as opposed to going to the doctor's office and the hospitals, you're seeing more care being provided in the home and in the communities. Of course, behavioral health as the isolation continues and as more and more folks are forced to stay home. Fortunately, we're starting to work our way out of that, but behavioral health is a major topic that everyone is going to have to keep a real close eye on as we go forward here. Social determinants of health, this is something that we often see overused in the industry, but certainly it is incredibly important as we go forward to take a look at the social determinants such as housing and food insecurity. There are many, many themes that are going to arise as it relates to social determinants that we need to keep a really close eye on for the individuals that are really hurting as a result of this pandemic. And lastly, an area that we've been focusing in on very, very closely is in the healthcare IT spaces. As you know, that is our specialty here at Softheon, and figuring out ways to build through artificial intelligence and machine learning, ways to improve diagnostics and contact tracing and things of that nature that you're hearing about more and more now as we start to reopen the country. How do we prevent or mitigate the risks associated with the next wave that everyone is saying is possibly coming? Howard alluded to over and over again this shift out of the employer-sponsored coverage, and I wanted to present here a little bit of a deeper dive into this concept of ICHRA. And I don't know about you who are listening, but I wasn't big into science when I was going to school, but this picture resonated so clearly with me related to where the industry is going, related to the group and commercial sponsored coverage versus the individual. And what you see here is literally the formation of a volcano through tectonic plate shifting. And it's a perfect depiction of the group market and the individual market converging to create a volcano. And this is the concept of ICHRA, or individual coverage health reimbursement arrangement. I know that our team has been talking about this concept for many months now, and I know that the program officially went live in January, but this is really the potential to push this over the tipping point and really get an increase in adoption. And you'll see that right at the point of the contact where that volcano is being created, you have the convergence of the brokers, the employers, and the employees, all critical stakeholders in the healthcare supply chain. And we'll dig into this quite a bit deeper as we move forward here. But just to set the stage on the concept of ICHRA a bit further, basically it's employer-sponsored coverage whereby employers can set a defined contribution for each of their employees, and the employees will essentially go out and purchase individual health coverage. So they're the ones that are responsible to own and manage their own health insurance while still being given a defined contribution from their employer. Now, when you talk about the ICHRA concept, there's really a shift in the priority for these different groups. When you talk about brokers, of course, they're looking for the most simple and streamlined tools to be able to enroll as many groups or individuals as possible, because of the fact that there's going to be a mad rush for folks to go and enroll in health insurance coverage. It's important to be able to serve the broker communities who help serve so many individuals out there in the market to be able to navigate that specific care. So the broker's priority is really going to be utilizing the most streamlined and effective process to enroll and manage as many folks as possible in a short period of time. When you look at the employers, I think that they're really having a tough time with this, especially the smaller employers who have been forced to shut their doors over the past several months. And just prior to the pandemic, you saw 78% of the overall ICHRA adoption was amongst the small employers. And you could think of this for a multitude of different reasons. One, employer-sponsored coverage is getting more and more expensive every year. And there's a majority of small employers who simply cannot afford employer-sponsored coverage and don't offer it to their employees. So as you think of the current state, healthcare is further off their radar as something that they should be focusing on. They're focusing on their reopening strategies. They're focusing on making sure that they can sustain their existing operation and come up with other more creative ways to push their specific product or service. So the priority for the employer is certainly not going to be in healthcare, and that's where we believe that ICHRA may be able to step in and be an option. And then when you consider the employees, Howard spoke quite a bit about the unemployment rates and how that continues to go up day after day. And for those that are still employed, it's in a totally different setting than what they've been used to for the past several years, if not their entire career. So what the employee is looking for now is affordable healthcare coverage. For those that have not had insurance previously, of course, they're looking to get insurance as a safety blanket in the event that they were to be impacted by COVID-19 or any other disease that may be out there. And the employees, when you think about it, when you talk about ICHRA, by offering an ICHRA solution, the employees are able to enroll in plans that work best for them, that are customized to their specific needs. In the current format that you have, employees are forced to enroll into a handful of plans, if there are any plans at all available, through their employer. So through ICHRA, employees will have the ability to enroll in plans that really meet their needs, especially in the current times. And one other point I want to make about the actual employee focus here is related to the fact that group plans are getting more and more expensive for the employees on a yearly basis. So on an annual basis, the premiums continue to increase and they don't have that choice. And that's really what ICHRA is solving for. So as we continue on here, we'll look at a way where everyone can win. There really is a solution here where nobody is left out, and it's a win-win for all of the players involved. Starting with the brokers, we've noticed in some of the issuers that we're working with across the country that they're establishing relationships with brokers to ultimately engage the employer into this ICHRA solution, which will allow employees to be able to obtain their healthcare coverage. So one of the main concerns from the broker community is losing that relationship with their employer and everything going into the hands of the individual. With ICHRA, that doesn't necessarily need to be the case. Brokers are able to establish relationships with the issuers in order to facilitate that enrollment and ongoing management of their healthcare. When you look at the employer gets to be able to set up different employee classes. There's a significant amount of guidance through the final rule from CMS related to ICHRA, where the employer can designate a defined contribution that may not be the same for part-time employees versus full-time employees. And there's a whole load of other classes that are designated as well. But what the employer is able to do, once again, is set those defined, affordable contributions where they know month over month what their budget is going to be. There's no fluctuation based on the plans that the employee chooses. The employer is able to simply set up their defined contributions and know exactly what they're going to be paying month over month. And when we talk about this relationship with the issuer, the employers are able to establish these channels with the issuers directly, whereby they can get some form of a list bill and be able to pay on behalf of all of the employees that have been enrolled for their specific defined contribution. So this is really the value that's being provided to the employer, where they don't need to spend a significant amount of time thinking about how to craft a group insurance plan or how to pay for varying premiums across all of their employees. They simply set the defined contribution and make that monthly payment. And when you look at it from the employee's perspective, as you mentioned, it's portable health insurance. So regardless of your employer, and in these unstable times, nothing, day by day, nothing is taken for granted. So the employee is able to have portable health insurance that they're able to take with them regardless of the relationship with their employer. As they've always done, they're also able to set up payroll deductions through their employers. This is an option through ICHRA, whereby if the employer was to be paying an issuer directly, they can establish a relationship with the employee to be able to deduct their premium from their specific payroll on a monthly basis. So the employer is able to further support the employee and make sure that the employee does not have to deal with some of the administrative work associated with managing individual insurance. And most important, and something that we are constantly working with our issuers on, is putting the employee and the consumer central to this entire experience, making sure that they're the ones that are ultimately served in the end, and the issuer is able to connect and serve those specific members. And when you look at this chart that we have here, the issuer is the one that is able to really facilitate this entire process to streamline that shift from group into individual through ICHRA. Now, as we continue on, consumerism is another term that is often overused. And when we look at consumerism with this shift going from the employer-sponsored coverage into individual plans, be it through ICHRA or individuals that are simply unemployed that are looking for an affordable care option through an ACA exchange, what we need to really focus in on is the consumer experience and making a streamlined journey for those consumers. What we have on the screen here is our portal that we are proud to partner with AARP to offer to their members to enroll in health insurance. And you'll see on the screen how simple the interface is. And the point that we're really looking to drive home here is the ability to take in the least amount of data possible and drive the consumer in the direction that works best for them. So as we go through this specific experience, we'll show you how simple healthcare can actually be. Because I know that as an average consumer, you really don't know what you ultimately qualify for. You need that guidance being provided by some form of technology to be told based on your age, based on where you live, based on other features that you'll be able to be pointed in the right direction. So you'll see in this specific example, based on the inputs, the consumer may be eligible for a multitude of different Medicare plans or even a dental plan. So the point that we're really trying to make here is that consumerism is such an important topic, and to be able to engage with these consumers immediately upon arrival and then hold on to them and continue to offer them a customized, personalized experience is what we're going for here. So as we continue on, we'll talk about the data-driven decision-making. Now, once you have these consumers enrolled or you're managing ICHRA, there's a whole bunch of different stakeholders that you're working to please in the supply chain. And being somebody who's born and raised on Long Island, and if you're from Long Island, you would know that we say on as opposed to in Long Island. But this screenshot that we have here is a dashboard that our state has implemented, and no political affiliation tied to this statement, but ultimately the state has gone to data-based decision-making in order to determine when it's safe for our area to reopen. And the reason why I bring this up is because as we exit the challenges that we've had from this pandemic, and as you look to support your consumers and your employers, it's critical to have the data set up and those analytics platforms in place to be able to help detect the next time that this wave is coming, or be able to act when something was to go wrong. So I wanted to share this just as a brief example. Of course, it's something that's near and dear to us in New York as we look forward to the day that we're able to safely reopen. But this is something that our state has implemented, and it has a tie to the next slide, which is how it impacts the health plans directly. Now, when you look at what we have on the screen here, there's quite a few different graphs that we've put together. And believe it or not, we've been tracing influenza immunizations going back several years. We've had data sources that were able to put together these types of models and dashboards that you'd be able to utilize in order to better understand what your population looks like. And again, tying back to the individuals and the groups that you're looking to serve, it's incredibly important to have these controls in place and to have these key indicators in place to identify and then ultimately take action on that specific population. And you'll see here, there's everything from, pie graphs to heat charts, and you could do so much with claims data, enrollment data, payment data to look at those social determinants of health and ultimately take action to make sure that your population is stable. This is a brief formula that we put together based on all that we've been monitoring, all that we've been mapping, and something that we wanted to share with those of you that are with us today. And it starts with the enrollment process, as we talked about, a streamlined, efficient, and effective consumer-centric enrollment process to get as many folks enrolled as possible and engage with them right from the very beginning. Once they enter into your ecosystem, there needs to be the ability to monitor those specific individuals as they navigate the healthcare system to determine where risks may end up arising. So in this case, you have real-time tracking capability to identify where there's an outbreak, or some more proactive identification whereby if there's a member in a specific geographical area that tests positive for COVID, how are you able to potentially reach out to that specific member or the members in the surrounding area to give them guidance on how to better navigate some of the challenges that may be ahead? Which moves us into the next step of this formula, which is to be able to act. One thing that we're hearing is that the premiums may double for next year, and Howard had alluded to it earlier that some of the burden may end up on the consumer. So what are issuers doing to consider things such as premium incentives, discounts, and even payment plans, which I know that some of the ACA exchanges are starting to mandate having a payment plan process in place in order to facilitate and support your membership. So if you have the monitoring in place from number 2, you'll be able to proactively act on these circumstances and continue to engage with your individuals. And when you think about the ACT aspect of this, if you're able to have that data, you can pull in other integration sources and other platforms that you may be working with, such as a behavioral health or a telehealth platform in order to continue that level of engagement and support the individuals that you're ultimately serving. And then that leads us to control. After you take action, how do you continue to control that specific population and further monitor those individuals that you may be supporting? And this is from a health perspective and a financial risk perspective. How do you continue to control and make sure that everything is stable and you're able to sustain your operations going forward? So this is the formula that we've been talking about internally as we continue to work with issuers across the country to make sure that they're in a position to succeed as we head into this next phase of recovery and renewal. Now, how do you continue to maintain all of this expected growth and transitions into ICHRA, and everyone was faced with implementing immediately work from home policies that many organizations simply were not ready to handle? And I know I was speaking with one health plan CEO earlier this week, and he said that the team was able to transition rather nicely, and there's really no data that would tell them otherwise why they should ever go back to the old way. And I know that at Softheon in particular, we've seen actually an increase in productivity as a result of implementing work from home policies. So I can assure you that there's organizations now that haven't thought about these types of things, that this is now front of mind. And one way to supplement this is through the digital workforce. And this was an interesting quote that we read from Forbes about what exactly the digital workforce means. And it's really using technology to offload the repetitive tasks that human beings are conducting so that humans can focus on using their creativity and skills to solve problems. We all know that there's certain things that robots can do very quickly and way more quick than an individual. And we also know that there's things that individuals and human beings can do that robots cannot. So the digital workforce is really balancing the two and taking away those mundane, repetitive tasks away from the individual and moving that towards the robots. And this is a way to taking everything we previously spoke about and sustaining that workforce going forward. A buzzword in the technology industry is robotic process automation. And everything that we build at Softheon follows this RPA framework or RPA principles. And generally, when you think about RPA, you think about individual robots that are deployed to conduct a specific task, a very small, specific task, and do it well over and over and over again. The benefits of robotic process automation is the ability to scale and continue to succeed the same way over and over. And the biggest thing about RPA is that they're able to be broken down into different containers and modularized. And we're going to talk about that quite a bit as we go forward here. But it's very important to take a look at how these RPA agents can help supplement your existing workforce that you have in place. When you talk about technology and continuing to sustain operations, you're going to see more and more with chatbots. And I know that if you look at me personally, I would much rather use a texting platform as opposed to calling in a number directly in order to solve a specific problem that can probably be resolved very quickly. So you're going to see an increase in the use of chatbots to be able to conduct specific tasks. In this example that we have here, it's just a chatty conversation that you could see where you'd almost think that you're talking to a human, but in fact, you're talking to a computer. And this is ways that you could supplement your existing customer service group where the reps that you have can focus on those more complex tasks and the exceptions, while you allow something like a chatbot, which people oftentimes will feel more comfortable with, those that are introverted, to be able to complete those tasks. So you're going to see more and more when it comes to AI chatbots and voice recognition and things of that nature. And as we continue to move forward here, I wanted to give an application. When you talk about artificial intelligence, when you talk about robotic process automation, and you talk about building sustainable solutions going forward, I wanted to give you an example of a specific use case from Softheon perspective that we've built as part of our vertically integrated platform. At the highest level, what you can see here is a breakdown of a whole bunch of different products into these tiles. You could think of these individual tiles as a container where different modules will live. And as you dig deeper, you'll see that this transforms into individual modules that can be deployed to solve a specific problem. So when you talk about your overall architecture and infrastructure, we're looking at taking these higher level concepts and continuing to dig deeper by creating these robotic process automation modules in order to support a specific product. Now, the use case we're going to show here is doing an initial enrollment for an individual. So an individual is going out and they're going through their shopping experience. How do you support that from a technical perspective? And we'll talk about the three products on the left: catalog, engagement, and eligibility. What you do is each of those individual modules that fall underneath products or containers, as we spoke about, get put into solutions and stories. So ultimately, with this framework that we're presenting here, you're able to take these different modules and either fit them into existing infrastructure that you already have in place, or you can build these modules as standalone applications that can be sequenced together to form a story. As you can see, starting out with the catalog aspect, those are the plans and the products that you're offering, going through engagement, where you can shop in a vision or dental plan, or even go all the way through to Medicare or Marketplace, and then finally finish with your eligibility and complete your enrollment. So the point of this slide here is when you think about your overall architecture and using technology to sustain operations going forward, consider an RPA approach whereby you have these containers and modules and you put all of that together to create solutions or stories to ultimately support your members and your groups. And I'll finish with this today. There was quite a bit of data that was presented by Howard earlier and some solutions that we're happy to share here. And really it comes down to the balance of growing your existing business and continuing to maintain your operations and operational sustainability. In growth, there's new markets that you may be considering expanding into. Do you have the technical infrastructure to support that, especially with increased members? Is your solution ready to scale? And are there strategic partnerships out there that you're looking to build to combine an enrollment system with a telehealth or behavioral health platform in order to thrive in this next wave? And then when you look at the sustainability, with all of these happenings and potential for increased membership, there's also increased financial risk and potential financial burden. So what are the controls that are in place to contain costs and ultimately mitigate risk through technology-enabled solutions so that when or if the next wave was to come, that we are all prepared as a nation to handle it? And with that, I would like to thank everyone for joining us today, and especially to Howard and the team at Oliver Wyman for co-hosting with us. And I will pass it back to Justin to take any questions.
Thank you, Howard and Kevin. We'd like to take the next 5 minutes to go through some questions that were sent in the chat. So the first question we have, I believe, is for Howard, is why does the commercial mix shift vary by state?
Yeah, thanks for that question. As I mentioned in the presentation, the mix shift varies by state for a few primary reasons. One is the number of covered lives that fall into a small group or mid-sized group or large group. So the starting point of where all the covered lives are. So that's one impact. And then industry weighting is another impact, whether that state is a Medicaid expansion state or not, whether it has an open enrollment on the exchanges or not. Those are the primary drivers of differences between a national view and from state to state.
Awesome, thank you. And we had another question come in, and I believe this one is for Kevin. So it do the employees purchase their policies on the retail market for ICHRA? Are then the employees at a disadvantage by not getting any group sale discount?
Thanks, Justin, and good question. So the way that ICHRA is really designed is that the individual employee is able to go out to one of the ACA exchanges, or they can purchase an off-exchange plan directly through the issuer. And one thing that I wanted to call out, that as part of the ICHRA rule, there's a concept of affordability, whereby if your defined contribution is considered unaffordable, you may qualify for a subsidy or tax credit through the exchange. So that is an option. When you talk about a disadvantage for group scale discounts, the employee actually has the option to either enroll into the ICHRA based on the defined contribution or go out and get an exchange subsidy. So from our side, we would argue that there's even more opportunity from an affordability perspective to go the ICHRA route, either on exchange or through an off-exchange plan.
Thank you, Kevin. The next question we have, I believe is also for Howard, is what are some of the new product strategies issuers will employ?
Thanks. Good question. So we touched on a number of them in terms of from a core health benefit standpoint, especially in the self-insured market, to think about affordability, to think about at-home care, to think about virtual care. So different benefit stacks that have more narrow networks that are more affordable, but also a lot of digital ways of interacting with payers and providers going forward. And so that's one type of innovation. Then there's innovation on, as I mentioned, in some of the ancillary and supplemental products around that as well.
Thanks, Howard. And then the last question we have here before we get to the top of the hour is for Kevin, and is what has been some of the main challenges payers have faced as a result of COVID-19, and what has Softheon done from a technology perspective to support them?
Yeah, that's a good question. And as I mentioned earlier, related to premium discounts and incentives, so a majority of what issuers have been doing is offering somewhere in the range of between 10 and 25% of a discount on premiums for members, as well as halting any termination or delinquency processes. And there's really no end in sight. We feel that this is going to go on for the next several months to make sure that members are not negatively impacted by financial crisis that they're going through. So some of the ways that we've been working with our issuers is to configure processes to disable delinquency and termination processes to keep these members enrolled, while also offering those premium discounts and incentives based on individual conditions. And as I mentioned, we're starting to see more and more related to payment plans, as members may not be able to afford their full premium for the next several months as they get back to work.
Thank you, Kevin. So that brings us to the top of the hour. So to wrap up, thank you again to both Kevin and Howard for presenting today, and to everyone who attended. Please be on the lookout for today's recordings in the coming days, and we hope everyone has a wonderful rest of their day. Goodbye.
Thanks, everybody.